Hello and welcome to week 11 of NUR1000. For week 10, you did a discussion board activity related to culture and communication. Looked over those. Most of them are complete. All of them are at least partially complete. But you guys discussed a variety of cultures, which was great to look over. Just a reminder, when we're caring for our patients, we want to make sure that we are providing culturally competent care, and we want to start practicing communication techniques that we can use to sort of get more information about a patient's culture if we're not, especially if we're not familiar with it, because we want to make sure we are providing that culturally competent care. You also had some practice questions related to communication, so we'll take a quick peek at those. For your communication practice questions, for question 1, you had a client saying, I'm not sure if I should have this surgery, and it's asking what's your best response. Correct answer is, tell me what concerns you have about the surgery, because that's going to be gathering more information. It's your decision, right? It's kind of final, not really therapeutic, not going to be getting any more information with that, kind of dismissive. Don't worry, everything will be fine. Well, we don't know everything's going to be fine, and they are worrying, so we don't want to say don't worry. We want to understand their worries and help give them any information that might help them with those worries. And then finally, this one, why do you not want to have the surgery? We don't start our questions with why, because it can make the patient feel a little bit defensive. So we like this open-ended, tell me what your concerns are, right? Not going to get a one-word response to a question like that. For question 2, you respond to a client's statement by saying, you say that your mother left you when you were 6 years old. That is an example of restating, which is a therapeutic communication technique. Next question, the patient's having ECT and says, I'm so afraid it will hurt and will make me worse off than I am. Correct answer is, can you tell me what you understand about the procedure? So again, gathering more information from the patients. Your fears are a sign that you really need the procedure. Isn't going to cause the patient to tell us more. Try not to worry. We know we don't say that. Those are very normal fears, but be assured that everything will be okay. Again, we're not sure that everything's going to be okay. We don't want to say that. We want them to talk about their fears, talk about what they understand about the procedure, so that we can better understand what type of information we can give them to help them feel more comfortable. For question 4, you had a mental health client angry after an argument on the phone with her son. She tells the nurse about the conversation. A therapeutic statement would be, you seem quite upset. So recognizing sort of their feelings, allowing them to expand upon those feelings. You don't want to say all mothers have arguments. Very, dismissive, not going to encourage conversation. You need to focus your energy on building your strengths and getting better. Is totally not acknowledging the fact that she feels angry about something. And then finally, that is not very kind of your son. Doesn't he realize you're trying to recoup from surgery? Not as therapeutic as recognizing how she's feeling and allowing her to discuss those feelings more. Question 5, a client says to the nurse, ever since my wife passed on, my life is empty and has no meaning. The nurse would make which appropriate response? In this question, the student picked, let's talk about the positive things that you have going on in your life, which I can understand why you might have thought, hey, that seems like the best option here. This one, again, we want to explore their concerns. So we don't want to be dismissive of the fact that he's feeling empty without his wife, right? Because if we say, let's talk about your positive things, we're backburnering that pain that he's experiencing and trying to talk about. And that's not what we want to do. We want to explore that with him. So your life has no meaning is a sort of a restating that allows the client then to expand upon how he's feeling since the wife left. Most people who lost a loved one feel empty. Again, kind of dismissive, like everyone can feel that way at some point. And what would your children think if they knew how you felt? We don't care what his children think in reality, especially in NCLEX world. We need to focus on him. So sort of getting him to talk more about why he feels his life has no meaning is the most therapeutic response. Next question, your nurse having a conversation with a hospitalized patient in mental health unit. Client states, the nurse, I work in a factory doing piecework and I'm very competitive with the people with whom I work. The nurse would plan to make which appropriate response? So in this case, the student put, do you find your fellow employees are also competitive? So sort of similar to what we said before, not correct because we don't care about the employees, we only care about our patient. So since that doesn't focus on the patient, it's not patient-centered, it's not going to be the correct answer. The correct answer is, in other words, you seem to be saying that you're trying to do better than your fellow employees. This type of answer is an example of paraphrasing. We're sort of restating, making sure that you're understanding what the patient is saying. What else we have here? When you are being paid piecework, you need to be competitive, right? Not gonna encourage much conversation there, not clarifying or anything like that. And this last one, why are you competitive? Well, we know right there that's not correct because it starts with WHY. Why? We don't ask those questions. Got a hospitalized patient being treated for depression who says women always get put down. It's as if we're useless members of society. Correct answer was, tell me how you feel as a woman. Nurse is employed in a mental health unit, meeting a client for the first time. Which nursing statement would be most appropriate to initiate conversation? The student put, have you ever been admitted to a mental health facility? So that is not the correct answer option. And the reason why is because it's a one word. One word could answer it. It's a yes or no, right? Have you ever been admitted? Yes, no. It's not encouraging conversation. So the more open-ended question, what would you like to discuss, would be the correct answer. Which statements made by the nurse indicate the use of therapeutic communication? What would you like to discuss? Can you describe your feelings? Can you tell me what the voices are saying? Are all great open-ended questions. And finally, what nursing actions involving client communication are appropriate? Maintaining a distance from the client that is non-threatening, analyzing the nonverbal behaviors of the client after the interview, and offering opportunities for the client to participate in the decision-making process. The week 10 math assignment, if you saw like a grade associated with it, was likely low because if the answers didn't exactly match my answer key, it marked it as incorrect. But don't worry about that. Those grades did not go into the grade book. You just had to complete the assignment in order to move forward in the module. But just to look through the answers here, largest to smallest, it's kilogram, gram, milligram, and then microgram. Oh, what do we have here? Oh, that's just going over those. No, it's not. Bear with me a moment. Okay, so 1 kilogram equals 1,000 grams. So if you like wrote 1,000 grams and put the word grams in there, it marked it as incorrect. Don't worry about that. So as long as you know 1 kilogram is 1,000 grams, you're good. 2 grams is 2,000 milligrams. 0.3 milligrams is 300 micrograms. 10 mLs is equal to 2 teaspoons. No wonder no one got that right because my answer key doesn't even convert it for the 10 mLs, right? So 1 teaspoon is 5 mLs. So if we have 10 mLs, that would be 2 teaspoons. And this one's asking you how many teaspoons is 2 tablespoons. So there's 3 teaspoons and 1 tablespoon, so that would be 6. 30 mLs and 1 ounce. Then you had some math. You had a med, ordered 250 milligrams, available as 500 milligram tablets. How many are you going to give? That would be half a tab per dose. A med, 250 milligrams 4 times a day, available in 500 milligram tablets. How many tablets would the nurse administer daily? It'd be a total of 2 tablets. Here's a liquid medication. Ordered is 250, available 250 per 5 mLs. How much are you going to give with each dose? Is 5. Ordered is 250, available is 125 per 5 mLs. How many milliliters would you administer with each dose? The correct answer for that one is 10. And if you have concerns about how to set that up using dimensional analysis, reach out to me. We can meet in my office during office hours or at a time that's convenient for you to go through that and make sure that you feel comfortable with setting those up using dimensional analysis. Okay, looking at quiz number 2 you had due in week 10. So question 1 is the nurse is reviewing nursing care plan for a hospitalized client with sickle cell crisis. Which client problem is the least priority? So rewording could be something like, what problem is least important for a patient with sickle cell crisis? Strategic words for this one, least important, it's giving you a clue that this is a negative event query. And then it asks that we label things as physical, safety, or feelings. Let's see what this student did here. They said pain is physical, dehydration is physical, inability to cope is psychosocial or feelings, and then lack of perfusion to peripheral tissues is physical, which is correct. Our second question here, let's look at this one. The nurse is reviewing the nursing care plan of a hospitalized client with sickle cell disease. Which client problem is the most important? And then you have some answer options. So reword the question. What's most important for someone with sickle cell crisis? Is how I would reword that when I'm considering these answer options. Any strategic words? Most important. That's telling me this is a prioritization question, so I can use my prioritization test-taking strategies. Is it positive or negative? It's a positive event query. One test-taking strategy to use. So this is most important, tells me it's prioritization. Just skimming over these, I can tell I'm going to be using my ABCs. So I'll use physical over safety over feelings, and then for physical answer options, I'm going to use my ABCs. So indicate the correct answer. I'm looking at the students here now. I would attend to O2 saturation of 89 first. I would agree, because in terms of ABC, this is related to respiratory, which means it's going to be prioritized over pain, over circulation, the BP of 80 over 50, and over feelings, I can't cope with the disease. Next question, after change of shift, you're assigned patients. Who do you see first? Rewording it, who's most important for me to see, who's my priority patient, whatever you want to say there. Strategic words in the stem is the word first. The modifying phrase, remember, is the end of these questions. So you got a 68-year-old on a vent, but the modifying phrase is they need a sputum sample sent to the lab. Got a 57-year-old with COPD, pulse ox reading of 90 from the previous shift. 72-year-old with pneumonia, they need to get their IV antibiotics started, and a 51-year-old with asthma who reports shortness of breath after using the bronchodilator. Okay, correct answer is D, the 51-year-old with asthma who reports shortness of breath after using the bronchodilator inhaler. We'd expect them to be feeling better, but they're still having an actual problem right now related to respiratory, making them a priority patient. Okay, last question. You enter the room, find a client pulseless and breathless. What action is next? Identify strategic words. The strategic word is next. We want to look at answer options and say if they're assessment or interventions. Let's see what the student did. They said 4B, they said call the physician is an intervention. Yep, it's a doing. So intervention is doing, assessment's getting more data. Begin CPR is an intervention, correct, that's doing. Auscultate lung sounds is an assessment, correct, that's gathering information. Obtain blood pressure is assessment, correct, that's obtaining information.